Good evening. Good evening to everyone. It is an honor for me to be with you and to share some of my thoughts. I'm sure that in this situation that we here in Israel have been also many times in, but every situation, of course, is very different. The situation of being in a war, the situation of fear, the situation of getting into survival mode. And I know how important it is for you also to be together. And so I'm honored to be with you, and I will start my PowerPoint presentation, and first we'll speak for some time, and if it's possible, although there's lots of people here, but if it's possible, then of course we would like to also have some questions. Julia?
Анна хотіла сказати, що трошки погано чутно. Є звук, потім немає, є звук, потім немає. Зараз все добре. Дякую.
So you see this PowerPoint presentation now?
Yep.
Yeah. Okay. So I'm a clinical psychologist and have been in the field of trauma as a therapist and as a scientist since 1979. And I've seen the field grow, and I'm sure that lots of you got lectures about how to treat trauma, what to do immediately, and many people give you sort of an instrument, give you a protocol of what to do. That is not what I want to do. I want to speak with you about what is survival mode, what happens also to us when we get into that, and what does that mean for our bodies, for our brain, and then think of how can people get into survival mode and get out of survival mode. Because that is basically, and I'm just jumping a bit forward, that is the whole thing about trauma. Post-traumatic stress disorder is, for me, the continuation of survival mode while the external situation has changed. So I think it's very important to understand what is that survival mode. And this is your situation. It is not like when you have a patient who does very different things than you yourself do. It is we ourselves are in crisis and we're trying to help others. And that is one of the difficult things that in these situations we are doing. So let's go on, and in this lecture I will talk about these 4 points. What is survival mode? How do we get in? How do we get out? What happens in the process? And what do we know about early interventions? So I'm not going to give you a very concrete tool, because sometimes these tools create more confusion than that it really helps to understand what basically is happening to all of us in these war situations. But before going into that, I want to share a metaphor with you. The metaphor of what happens in nature in nature, there is a lot of resilience, and I found this one example of it, and I want to share that with you. So here, there is a tree that I found in the garden of a building I was living in some years ago. And I wanted to see basically what is happening with a tree after such a severe trauma, you could say. What happens in nature? So I started to follow this tree, and what you see that a few weeks after the trauma, it starts to grow.
Я перепрошую, а можемо ми зупинитися і наладити технічні питання, бо звука
And
українського
let's
майже не
follow
чути, навіть коли зроблені всі налаштування.
This tree, this is 6 weeks later.
Sorry, there is a problem with translation. We don't hear whole translation.
Yeah,
Чути, але не постійно. Одне слово чути, друге не чути. Я що думаю, чи у нас, я спитала, чи у нас є тут ще перекладачі, можливо, хтось є перекладач, може допомогти. Інше ми можемо зараз спробувати без синхронного перекладу один за одним перекладати. Зараз можемо так спробувати, щоб подивитись, чи так краще чутно. Denny, is it possible, as there is a problem with noise of translation, we can try if you talk and she translates probably like that, we will not have this problem. Is it possible?
okay. Okay, so yeah, how do we do that? Is that since I started this presentation in this way?
Yes, since you started, we didn't hear very well translate.
Okay, so maybe now I changed something. Maybe you can look at this now if it works.
Yeah.
Can you try again? So now translate. Is it gone? Does this work better?
Аня,
Слышно.
так, можливо,
Yeah.
так краще. Давайте
So, okay, so
Да.
we will continue. And here you see the tree 2 months into the process. And you see how, where before that, nothing was growing, suddenly it starts to grow. And that's very interesting. So that after a few months, and on the, where it was cut, there nothing grows, but around it, it grows. So that after 5 months, 6 months, you don't even see where it was cut, you see the tree. And I wondered, is that a good metaphor of how also human beings can react to severe trauma? How do we get around it? And I then became interested in older traumas, in a scar that is old and ugly, but every May, April, May, something around that scar is growing again. And that is a very interesting metaphor for trauma, so that you see the tree, you don't see really the scars. And here you see a bush that is growing in the desert. And what happens when a tree, or when there is the need to keep your water in, then you roll your leaves so that you cannot lose all the thing to the sun. And there's also this plant in the desert. When you are in a bad situation, and animals want to eat your fruit, then this bush develops these prickly things to keep people away. Well, do we know that from people who grow up as children in a hard situation, that they do like this? Julia?
Юля, ти зам'ючена.
Анна, чи є в тебе наушники? Можливо, через наушники буде краще. We're going to try to use headphones. Maybe it's going to be better with the noise, with the voice.
There's still noise.
Yeah, it's still losing some words we hear, some words we lose. Sorry.
Okay.
There is always some question when it comes to online. I'm sorry.
Yeah, that is technology.
Yeah.
Okay. Is this better now? Is this, Anna, can you hear me? And can you speak? Yeah. Okay.
No,
So,
you cannot hear Anna, but we hope that everything will be fine right now. Thank you very much.
So we'll continue.
Зараз добре. Подивимось зараз, як буде йти. Дякую.
Okay. So getting from the nature to this drawing basically only says that we have to remember that trauma is not something that comes out of nowhere. It is what people do to people. And we're all in the same boat. And what happens here is one of us makes these holes and it creates a lot of anxiety. And I also want to share this poem that was written by a Holocaust survivor. And she basically says something very important about coping with trauma. So here's what she writes. I want to remember my past, to see before my eyes the image of my parents, the house I grew up in, the village in which my family lived for generations. I don't want to remember my past. I'm afraid of what my memory might bring before my eyes, and I wonder whether I could continue my life if I would recover from forgetfulness what I want to remember. So the question is, how can you be afraid of something you don't remember? That is a strange paradox, but it is possible, and that is exactly the issue with trauma, is that you can know and not know on different levels. And that is what we need to, certainly with children, and this woman was a child during the Holocaust, we need to know that people sometimes remember something and don't remember something else. It depends on what, how much the impact hits you. And another thing that I want to share with you is a 14-year-old child during the time in Israel when there was lots of really bad terrorism happening. And she just wrote that while she was in class and gave it to her teacher. And so let's look at this and ask ourselves, what is this? Is this girl post-traumatic, or what is this? So here is what she writes. While you were showering, a mortar fell and 3 people died. While you were sleeping, shots were fired and 8 soldiers were wounded. While you were eating, terrorists infiltrated the house where children were sleeping. And while you were saying the grace after meals, all that remained of the children were pieces. While you were playing, a terrorist entered a hall full of people. And while you were losing, their souls left their bodies, the guest, the bride, and the groom. So let's hurry, let's run, let's get organized, let's finish, let's do as much as we can, for who knows what will happen the next time someone sits down to eat. A very well-spoken poem written by this girl, a very talented girl, and I can tell you that she wasn't post-traumatic. She was a normal person living in crazy situations and coping with it. And it's interesting what she is saying, what her conclusion is of all these things happening. And she says, so let's hurry, let's do as much as we can, for who knows what will happen. And especially in children and adolescents, we will see these kinds of things, that if all these bad things can happen, then who cares what really will happen? And we see that a lot. So here is what I call the survival mode. What happens when we need to survive when there is severe danger? We basically have 2 systems of reaction. The first is the threat detection system. It's the physical arousal system. Now, lots of people, I think, probably have talked with you about the amygdala in the brain and about fight, flight, freeze. Well, that's only part of it. We do have this threat detection system, and all of you know it, maybe from now in the past few weeks, or from driving in a car and everything is okay, and suddenly someone cuts you off. And what do you do? And what you basically do is, before thinking, before feeling, you do something to survive, which is something that you do not have to think about. It is very instinctual and very effective. It's amazing how effective people can be while in this survival mode. You do exactly what is needed. And yes, fight and flight and freeze are in there. But the question then afterwards is, under what conditions can you get out of that survival mode? Because survival mode changes the brain, physically changes the brain. We know that soldiers who are in the army for prolonged periods come out with a different brain. It can be, for a large part, it can go back, but first we need to understand what changes and what gets conditioned, what kind of things change in how they see the world. And we all know how post-traumatic people, but not only post-traumatic people, react to reminders of these situations. But the second thing that is much less being taught about is that during survival mode, we bond with others in a very different way than in regular life. We bond in a very strong way. And that is in order to get information, it's a very primitive and early in development. We, here in Israel, a lot of people, when they get frightened, they say in Hebrew then, "Mommy, oh mommy." There's this very strong inclination to bond. It is good on the one side. We see it also in people who've gone through abuse and were being abused in a room by someone, and the attachment goes to whoever is present while you are in survival mode. And that is also how we see that abused people who've gone through terrible violence, they feel longing for their abusers. And that is a very difficult thing for us as therapists to see, but we need to know that this is a hormonal and response that is connected with the need to not be alone during survival mode. And so we have this innate survival mode that always is there. So it goes, survival of the body is survival through the body. We do all these things instinctively. Also, and not only the fight, flight, and freeze, but also the attachment. The attachment is very, very strong. And we see that certainly also when you are now in different places and you now bond with people in your new environment, that can be very, very strong. So levels of arousal, right? When you're listening to a lecture, your arousal goes a bit down. When you feel how hungry you are, then maybe the arousal gets up a bit. But the question is, what happens when something really comes in and throws you into hyper arousal? When there's real danger and you need to survive. So then not only you feel the hyperarousal or hypoarousal, but then afterwards it creates a situation in which afterwards very easily you can get back into hyperarousal or hypoarousal. And there's one thing we know about coping with trauma, that processing trauma can only happen brain-wise. It can only happen if your arousal is within that window of tolerance. If your arousal is not too much and not too low. And that is a basic condition for getting out of survival mode. And yes, the brain changes. There's more and more known about it, that during survival mode, different parts, maybe you've heard about the amygdala. The amygdala, which is sort of the smoke detector of our brain, that fires, and when there is danger, that takes over. When the amygdala says danger, we get into survival mode. And in survival mode, the whole structure of our responses in the brain change. So I cannot go too much into this, but I will jump to this. Now, what happens during or after survival mode? The first thing that I guess you can also feel right now is that while in survival mode, there is no long-term planning. There's only here and now. Everything is focused on what is the next thing to do in order to be safe. So you see that in many people, and that planning is just off. And then how do we cope with feelings of helplessness? And we all feel it in this situation. And for me, it helps to then try and help you. But when you are in this situation, the helplessness, people can feel many different things in a very strong way. People can be angry, people can be anxious in a very strong way. But helplessness is one of those things that human beings try to avoid almost at all costs. So people want to do, and that is what they very often do. So I already said something about traumatic bonding, which also can be used in intervention programs. When people are in survival mode, they're also more open to bonding with people and helping each other, while in a war, people help each other much more than in normal situations. There is a problem.
I can see that people asking right now to make a translation one after another.
Aha.
I don't know. Будь ласка, скажіть, зробити так, рвані речення виходять, втрат. Угу.
So shall we try
Давай,
that?
Було нормально. Більш-менш нормально.
Мені теж більш-менш нормально було.
Yeah.
Давайте 50 на 50. I can see that 50 asking one after another. Let's try one.
Багато слів я додумаю сама, тому що не чути, випадають деякі слова.
Англійською? Anna, let's try one after another. We'll see how it works. Denny.
Okay. So, yeah, we'll continue and
Нічого
see.
не змінювати. Все так і робити. Denny will not hear you. Denny, you will not hear Anna. Denny, can you turn on Ukrainian translation in the place when there is a globe? You choose Ukrainian.
Where is that?
It's on Zoom.
Будь ласка, тоді всі можете включити оригінальну доріжку.
I don't see translation at my place. Where?
It's in Zoom, where you have the ribbon with the icons, mute, start video, participants, and then the red button, leave. So, and there is the globe interpretation. It's the bottom.
Don't have
It's the bottom of the screen.
Вибачаюсь, в такій ситуації взагалі-то просто говорять в один канал. Перекладач говорить в тому ж каналі, в якому і спікер. Це набагато легше, ніж переходити на interpretation.
Then if you can move out of full screen, press the escape, then you have a smaller screen, and then just put any finger on the screen, you'll have what she's talking about. In the more...
Oh, okay, interpretation. Yes, I see that.
Anna, can you say something? Я не чую тебе. Український залишаємо.
Okay.
Anna.
I put it on.
Yes. Denny, can you hear Anna right now?
Yes.
Okay. Thank you. We're saying sorry.
Okay.
Окей.
Sylvia?
So now I have to go back and do this.
Even de boek.
So the traumatic bonding is something that can be used while you are trying to help people be together. They want to be together, and they're much more open to helping each other than in normal situations. And then there is the sensation seeking. We see that especially in adolescence, but not only. There is and especially when there is a time that people can sort of relax a bit, then you see a lot of people who are continuing to seek high stress. And this can be especially difficult if you work with adolescents who see all what is happening and then start to do dangerous things. And we've seen that a lot here in Israel. It has to do with adrenaline. We're all in adrenaline situations in survival mode, and adrenaline feels good in a way. And then afterwards, we also see the in-group and out-group, which is it's sort of a instinctual decision. There is the friend and there's the enemy, and there's the danger that that becomes a very generalized thing, so that people decide about whole groups that now they've become dangerous. And something that we've also learned is that during survival mode, people learn much quicker than in any other situation. You might ask yourself, if you've driven for 20 or 30 years in a car, and then there is a car accident, how can it be that suddenly one accident makes it impossible for you to go back driving? As if you forget about all those 30 years that you've been driving. But we need, as human beings, we need to create a cognitive frame, a story that tells us why this happened and how we can be sure that it won't happen tomorrow again. And that is what this learning is about. The last thing is during or in a traumatic situation, during survival mode, you get dysregulated. You don't feel, you just do, and the feelings come later. And of course, the question is afterwards, how do you bring the memory and feelings and cognitions all together in a regulated way? So then the question is, what do we do with all of this? And does psychological first aid, the immediate intervention, does it really work? And a lot of people will tell you, I know exactly what you should do. And those people are, I'm not sure that you would have to listen to them, because basically the question is, what for? Help for what? So a lot of people then talk about preventing post-traumatic stress disorder. And we have to be honest, we do not know exactly how to prevent post-traumatic stress disorder. But that doesn't mean interventions are not important. People need to be together, and trauma throws you into loneliness. There are lots of people who will come and tell you that you can learn how to prevent PTSD, post-traumatic stress disorder. Just not true. There's lots of other things that we can do by getting in contact and being with people. And what we know, for example, from this and the whole literature is early intervention, if you want to reduce symptoms, is effective only for those who really have a lot of symptoms. If you want to reduce post-traumatic symptoms, then that works only for those who are high on symptoms. Those might be good targets for intervention. So, yeah, Stephen Hopfall did a very good study on what are the basic elements that are most helpful in early interventions. So the first thing is, in some way, creating a sense of safety. And it's amazing that you can do that even being in a war zone. Certainly for your children, it's very important that the adult stays a reliable source of information and of support, meaning I am taking care of you. And the second thing is then, how do you help people to regulate themselves, to make themselves calm, to soothe themselves? Now, lots of people come and tell you, well, you might be able to do the butterfly hug. Or other simple things. But I am saying just being together and bringing someone a cup of warm tea or coffee, and having people look into each other's eyes will be even more effective. And then, in order for people not to feel helpless, you want people to feel self-efficacy and collective efficacy. So you want people to do things, and there's no better way to help yourself than help others. And create connections. Make people connect with each other as long as it is a safe connection. We have to be also honest about the dangers of survival mode. One of the dangers, especially in men, is that there is a strengthened sexual inclination, sexual response. And that can make connections really unsafe. So that is something that in all situations, in disaster situations, we find over and over that the number of rapes and abuse goes up terribly. So something to really look at and make sure that that does not happen. And the last thing that Hopeful said is always a part of early intervention is creating hope. And that can be done in very different ways. For example, in children, here in Israel, while in war, we have asked them to interview their grandparents. And ask them, have you ever been in such a situation of war? And all grandparents say, yes, I've been there, and it passed. So you create a perspective so that, because during survival mode, there is no perspective, it's only danger and survival. So here are the things that we want to do with people to make it once more very clear. So diminishing helplessness or giving control, meaning if you work with people in these situations, always ask before you do something for people. And as helpers, sometimes we want to help too much and we take over. And you need to basically give the control to the person. And human relations is, of course, the most important way to help people regulate themselves. And it's not only, as we helpers or mental health professionals do so much, it's not only looking for emotions, it's looking for connection. And also, when people are in survival mode, they might forget all kinds of things because your brain reacts differently. So they need concrete information. What are their rights? Where do you get food? Where can you be safe? All these things, it has to be concrete. And of course, everything depends on, does the situation allow us to relax? Is it okay to relax? Or if you are in danger, maybe you'd better stay in your hyper-aroused situation because it's effective for survival. And then people are always looking for meaning. what does all of this mean? Why does it happen? And some people tend to jump into knowing why it is happening. And other people can take more time and say, I don't know, maybe we'll know later. So all of this is a package of human connection where you allow a person to lean back a bit and start processing, because processing starts only when the situation becomes safer. So maybe it is an idea to stop here and see if there are questions of more concrete, or maybe someone wants to tell us about a bit about someone they're seeing and what to do. I invite you.
Якщо можна, я б хотіла запитати. Зможете перекласти, бо я англійською внятно не зможу. Так. Дивіться, мова йшла про сексуальні, скажімо так, потяги і злочини. І я б хотіла запитати, що можуть запропонувати в випадках, коли звертається людина. Я отримувала такі пропозиції працювати з жінкою, котру зґвалтували російські солдати, але, чесно кажучи, в мене не такий великий досвід, і я просто, можна сказати, тривожилась, злякалася, я не взяла такої відповідальності на себе, щоб брати цю жінку в роботу, думала, більш кращі спеціалісти знайдуться, але якщо, можливо, може якісь поради такі дуже нам нададуть, було б дуже класно це почути, бо це буде травма, яка буде потребувати постійної уваги, на жаль.
Yeah. So trauma work, especially in this situation, always touches us in our most vulnerable places. And we need to be able to contain and to hold that while being with people. It is an issue of enormous courage to, even if you're anxious, to stay with that person and say, I want to hear more. What happened? unfortunately, we need to hear, we need to witness for each other so that they get also the message that it's okay to speak about it. I don't know if this is an answer, but this is my personal way of trying to be present for people.
Мгм. Я зрозуміла, дуже дякую. Я просто думала, знаєте, що окрім цього потрібно ще щось надавати. Окрім того, я знаю, що я витримаю вислухати, але я боялася, що в мене немає ресурсів, що ще здати людині.
So you are the resource. You really are the resource if you can be present and be with a person and look her in the eyes and see the fear and feel your own fear and do that together.
I understand. Thank you so much.
Добрий день. Можна запитання?
Sure.
Скажіть, будь ласка, у нас просто в Києві організовується група психологів, які будуть допомагати дітям-сиротам, які втратили батьків. Скажіть, будь ласка, які самі такі методи дійові, які можна використати з дітьми, які втратили батьків? Який метод, яка методика роботи?
A horrible question. But that's the horrible reality. We know that these children are at risk for long-term problems in their lives. And we need to get out of the idea that a certain technique will help them get over it quickly. They need attachment. They need an environment that can deal with them. And I can tell you personally, my parents, after the Holocaust, decided to give up what they were doing, to work in children's homes of children who came out of the concentration camps or out of hiding. No. They stopped. My father was a musician and he gave up his music to go and work in children's and orphanages in Europe. So providing yourself as this is not an hour a week therapy, but this is engaging in ongoing attachment and hoping that you can do that for a long time is what is needed. And children tend to accuse themselves or think that they are to blame for what happens in this world. So being with them, being able to embrace them, being able to or see who can in a safe way embrace them, hug them, and accompany them along their development is what is needed.
Thank you very much.
Доброго дня. Я є, наприклад, дуже емоційна і хотів запитати, допустимо буде, якщо не стримаєш сліз при роботі з такими дітьми або постраждалими.
Yes, sometimes I cry with people.
Зараз є дві форми школи. Або ти прийшов на курс,
The question is then,
інтернет, якби альтернатива школи.
and the consideration here is whether if I let myself go into that, whether the person will feel it as a confirmation or as a burden. In general, in therapy, I encourage people and my students to feel, to tune in, and that has a price. That is not easy, certainly not in your situation, because there's lots of feelings, very hard feelings and fears. They're just there.
Давайте я прочитаю. Які рекомендації, на якому етапі після переживання травми на війні варто звертатись до почуттів, запросити людину прожити ті емоції, яким не було місця в кризовій ситуації? На якому етапі потрібно включати?
First of all, I think that the word trauma comes from Greek and means wound. The question, when you have a wound, you don't treat a wound, but you treat what is around the wound. You make around the wound clean so that the wound can heal. So if this metaphor is fitting, what we want to do is create a situation in which a person can feel again, which means helping them regulate themselves, helping them relate to other people, being able to look someone in the eye, being able to hug someone in a safe way. All these things are, we don't have to decide when the person should feel or should be invited to feel. The feeling is a consequence of getting out of survival mode. And we can make that possible if we are there for them in the right way.
Коли ми працюємо з зґвалтуванням, чи психолог має бути тої ж самої статі, чи іншої, чи, можливо, іншої?
Very individual. Of course, the most important is that the therapist is safe. It makes a lot of sense that a woman would want to see a woman. But there are also people who have a specific wish to see either a man or a woman. So I wouldn't say that there's a golden rule that it's only the same sex. No. Ask the person.
Шановні колеги, чи є ще запитання?
Да, в мене є ще теж запитання. Дивіться, таке питання, як зрозуміти, буде це травма для жінки, коли була попитка зґвалтування, але вона, в принципі, вспоминає це не реагуючи якось. Це може все-таки бути травмою чи ні? І як поняти, коли це травма, а коли це травма як самостілення, да, буває? Не всі люди отримують травму після свого цього досвіду. Як зрозуміти, травма чи не травма? Угу. Дякую.
So, yeah, are you talking about a dissociative response, dissociation, or someone who you think has processed and is now less emotional?
Да, це ситуація, коли згадують менш емоційно.
Yeah. So if the person still can feel, but has the ability now to regulate himself and speak about it, but doesn't feel the need to speak about it, that sounds okay. But if the person basically says, I can't speak about it, I don't want to speak about it, don't touch it, please, and or says, I hardly remember it, then we are looking at dissociation, which means a sign for later, possibly for later problems.
Хорошо, дякую. Відповіли на питання.
Ань, там є питання, як може бути корисно в гуртожитку? Подиви. Як я можу бути я прочитаю, як я можу бути корисна у гуртожитку для біженців, якщо люди щойно приїхали з місць бойових дій та ще не виказують бажання працювати з психологом. Як я можу бути корисною, проте не шкодити своєю ініціативою?
It's a wonderful question. We are very limited in what we offer. The expert here is the refugee. So just be without they don't have to speak. They don't have to be in a room specially for therapy. Just be in the environment and try to create a group sense among the refugees. In these war and disaster situations, we need to get off our thinking of one-on-one. We have to go into the community and create connections between people. There's never going to be enough therapists if you think one-on-one. People need community. So there is a lot of programs on how to create groups, how to do things that are meaningful with people without asking them, now tell me what happened to you or tell me how you feel. That in these situations is not fitting. And maybe you can feel it yourself also. I know that many of you are not in Ukraine. Is this the time you want to really talk about how that feels? Probably not, but I don't know. So this will be long-term, and we have to think, if we can, longer term of how, let's hope that the war will stop now, but even if that is so, the consequences will be long-term. We have to prepare ourselves that it's okay not to engage into individual therapy. It is more important that people can stay connected, that they have the opportunity to relax a bit, to help each other, and all these kinds of things of building a community. And let's also remember that the majority of refugees or people going through all of this, the majority is not going to develop post-traumatic stress disorder. But they need each other, like all of us.
Давайте, можливо, останнє питання, що у нас вже час.
А можна спитати, а якщо це, а если человек, например, ну, больше шизоидного расстройства или ему, в принципе, классно быть в одиночестве. Что тогда делать с такими людьми, если их коммуникацию тяжело вести в таком, после таких происшествий? Спасибо.
What a difficult question. You mean people who have a schizoid personality even before all of this happened?
Да. Yes.
Yes. Yes. Yes. Well, we know that for that kind of personality, our tools are very limited. You would want them to be in groups, you would want to engage them, but it's certainly not an easy thing in this situation. Yeah. I wonder whether Yuda Frankel has something to say about this. He's also here, a psychiatrist and a friend in Jerusalem. Do you have anything you would want to add?
Well, the main thing I want to, not to add, but to repeat is what Professor Brom has answered in the beginning or in the middle. We are all looking for resources, but Professor Brom tells us two things. One, we are the resource. Truly, we are the resource. All these lectures and understandings will take us off track. We, with our knowledge and experience and human capabilities, are the resource. And the second thing Professor Brom said is that actually the refugees have to be empowered to be back their own or their families or their close friends' resources. And I think Professor Brom clearly taught us, process content, that he is a resource for us in his human ability to touch us, to help us, to be with us. Something about the schizoid.
Let give Anna a moment for translation.
And I think it's also, for a moment, looking at the scientific sphere. Truly, this is for us to experience that, whether it's neurobiology, brain sciences, cognitive, behavioral approaches, and psychoanalytic approaches, we end up in trauma exactly in the same place. It's about being, it's about containing, it's about experiencing, and it's about reaching out. Whether it's amygdala or Oedipus, it's the same final common pathway for all of us. Also, a moment about the schizoid patient, the patient who is detached. Well, actually, they're the ones who already have the capability to split and to detach from the trauma. So if they do not present with symptoms, they would be the second group to treat. The first group would be the people who are in touch and then fall apart because of taking in the terrible happenings and the acute events. The schizoid will already have the defenses against that. So they are not our first line of treatment.
So coming to an end of our being together, I can tell you there is one big problem with technology. And that is maybe it'll come at some point, but there still is no way to hug each other through Zoom. Because that is basically what we all need.
Можна я скажу два слова, не можу стриматись. Просто я, звичайно, зараз слухаю багато лекцій по кризовій і травмотерапії, бо це необхідно. І всі говорять, всі кажуть про когніції, і я розумію, це класно, але сьогодні, знаєте, я відчула, що я жива, бо моє серце скам'яніло останнім часом, і я так вдячна Денні за його емпатичність. Я, знаєте, як сеанс власної психотерапії пройшла, і мені стало з одного боку легше і краще, з іншого я розумію, що я жива, я не розпадуся, я не розслабилась, але я розумію, що я людина, і не з кам'яним серцем все ж таки. Дякую дуже.
Так, дозвольте, будь ласка, ще додати. Так,
That is very nice to hear. And I think it is exactly that coming out of survival mode for a moment even, where you can feel that life is not only surviving, it is living.
Так, і ще хочу щиро сказати спасибі, адже це взагалі мій перший досвід лекції, щось того типу. Я взагалі волонтерю із біженцями, та мені дуже головне було почути те, що ми шукаємо не саме емоцію, не відчуття людей, їхній біль, а саме стосунку, який вже допоможе їм регулювати себе. Тому за це речення я дуже дякую, тому що досить холодно було знаходитись весь цей період тільки в потребах якихось там технік або ж інструментів для праці. Основне – це людина і ресурс. Тому спасибі за це речення. Гріє.
So I wish I would be able to see all of you. For whoever it is possible, we do have an international summer course in the summer for 3 weeks in Jerusalem. If anyone would be capable or of coming there, I think it would be an honor to be together and learn together, because I think you're also learning. In this situation, you're learning a lot. And learning for me as a psychologist and all of us is very often unlearning of things that we have in our minds and have to get rid of. To just be present and connect. So,
Thank you much, Denny.
Okay. Thank you all. Be safe and be well. And I hope to see you again, and I'm open to thinking further if there's anything I can help you with.
Thank you very much, Denny. Thank you
Okay.
very much, Yuda, for helping us to organize that. And thank you very much, Anchika, for translation, for a lot of questions. Right now it's perfect, so thank you so much. Thank you so much. Thank you.
Thank you. So
all.
have a good night and be safe and